Hey, it's Dr. Weimer with Dragonfly Menopause Care. An interesting question came up a couple times recently about birth control pills and perimenopause. One was from a patient who is 52 and she was just told that maybe she should go off birth control because she's very much perimenopausal, or so it seems, and her doctor thought that this was the time to switch to HRT and ultimately referred her to me. And then I spoke to a physician about perimenopause and birth control versus HRT, what's the right thing to do? Well, interestingly, this 52-year-old patient, having been on birth control pills for many years, she said that she was starting to have a lot of perimenopausal symptoms, and a lot of brain fog was one of her main symptoms, and that she actually noticed it improved when she went off her birth control pills. And I explained to her that likely her ovaries started working again for the first time in many years, whereas they'd been essentially shut off by her birth control pill. Now that she has stopped the birth control pill, she was starting to have some symptom relief being off of it because she was getting some of her bioidentical, I guess you could say, estradiol back. But she was still pretty symptomatic, and we started her on estradiol and progesterone. Now, with other patients who are perimenopausal, younger, maybe late 30s, early 40s, what to do? If birth control is important, we can certainly do birth control, but I don't prescribe that often. Some women have IUDs, and we can do estradiol and progesterone capsules, the bioidenticals of all of those, along with an IUD. Sometimes women are not worried about getting pregnant. They don't have, their husbands had a vasectomy, or they've had procedures that prevent them from getting pregnant. And so even younger patients, I can start on estradiol or just progesterone. Sometimes that's enough for the beginning, but I often will do low-dose estradiol and progesterone in those cases. It just depends. Again, like all of this, it's very patient-specific, but you can be on birth control and still be wildly symptomatic, which is quite interesting. My only interpretation of that is that it's not your bioidentical hormones in birth control. It's synthetic estrogen, progesterone that is provided at large doses, enough to shut off the ovaries essentially. So that's what is the difference. And so if you are a patient who is having those symptoms and you're wondering if HRT might be a better option for you, it might be. Maybe testosterone too. So if that's interesting to you and you'd like some help, if you'd like to reach out to me, I'd be happy to answer some questions, or I'd love to meet you in clinic. You can schedule through my website, dragonflymenopausecare.com. Thanks, and have a great day.